So in this class we will see the spermatic cord. Spermatic cord is a tubular sheath containing the vas deferens mainly, vessels and nerves of the testis and epididymis also. So it's a very short topic. So it is a tubular sheath extending from the deep inguinal ring to the posterior border of the testis, and it's about 7.5 centimeter long. It has three coverings, same like the corresponding coverings of the testis. During the descent of the testis along the inguinal canal, the spermatic cord also receives the three tubular prolongations from the abdominal wall muscles. So, what are the coverings of the testis? From the abdominal wall muscles, you should have learnt internal spermatic fascia from the fascia transversalis at the margin of the deep ring, cremasteric muscle and fascia from the internal oblique muscle, external spermatic fascia from the aponeurosis of the external oblique muscle at the margin of the superficial inguinal ring. So these are the coverings. You should write as definition, that is the tubular sheath containing the vas deferens and vessels and nerves of the testis and epididymis. Then extend, you have to write as extends from length, then coverings of the testis, then we will see the contents of the testis. Contents of the testis I have given us only a very short. If you are asked as 5 marks like that, you can elaborate this and write. Vas deferens is the most important structure. It will be present in the posterior part of the cord. Then the pampiniform plexus of veins. At the superficial ring, the plexus join to form 4 veins. 2 veins accompany the testicular artery, and the remaining 2 pass along the front and back of the vas deferens. At the deep ring, the veins unite to form 2 veins. Arteries, main artery is the testicular artery. It's a branch of abdominal aorta. Artery to the vas deferens from the superior or inferior vesical artery, and cremasteric artery from the inferior epigastric artery. Then the lymphatics of the testis and epididymis also pass in this. Nerves of the testis, genital branch of the genitofemoral nerve, and testicular plexus containing mainly the sympathetic T10 and T11. Then along with that, main important content is the loose connective tissue, which is continuous at the deep ring with the extraperitoneal connective tissue. Sometimes vestige of processus vaginalis may also present. We have learnt in the inguinal hernia class this processus vaginalis, which develops during the descent of the testis, obliterates normally. If it is patent, it causes various types of the oblique inguinal hernia. So normally it obliterates and persists as a fibrous thread that will be also present. So these are the contents of the spermatic cord. So this is the image of the spermatic cord. You can see the lowermost part, testis, covered by the tunica vaginalis. Along with that, epididymis also you are seeing. From the epididymis, you should see the vas deferens, which is the main content of the spermatic cord. So surrounding this vas deferens, pampiniform plexus of veins and some arteries are also visible. The cremasteric fascia is cut open to show the structures. So we have covered this spermatic cord as very short topic, like definition, extent, length, coverings, contents of the spermatic cord. It has applied anatomy that the vas deferens will be ligated in the vasectomy surgeries. In the family planning procedures for the male, it should be palpated in the spermatic cord and it is ligated there. So that is the importance of the spermatic cord. So I think you should have understood this short answer question, spermatic cord.